As a healthcare worker running tirelessly around the clock, learning the correct body mechanics to safely transfer patients is essential to developing a healthy practice. In this video, we'll take a moment to review the supervised transfer and the steps to properly execute this technique. So, what is a supervised transfer, and when should it be used? A supervised transfer is appropriate for patients who require little to no physical assistance. These patients may require some verbal guidance or assistance with the equipment. It's the responsibility of you, the caregiver, to ensure that all the safety precautions are followed. In order to properly administer a supervised transfer, ensure that you follow the 3 stages from preparation, execution, to completion. Preparation is a key component to making a successful patient transfer, and it's important to always start here. This step will ensure that your patient is safe and is ready to be transferred. Always begin by checking the patient's chart to be sure that you are using the appropriate transfer for the patient. Speak with the nurse whom you are replacing or other healthcare providers about the patient's status that day. Determine if you're capable of making the transfer on your own. If needed, make sure that you seek assistance for the transfer. Ensure that you communicate with your client where they will be going, what you will be doing, and be sure to obtain consent. Make sure that your patient is wearing proper footwear. Check your environment to eliminate any obstacles by preparing the space and clearing the path, such as IV lines and catheters. Ensure the patient's hips are higher than their knees. Prepare the surface level equipment such as brakes, foot plates, level of bed, and seat belts. Start off by positioning yourself using good posture, and remember to always stand close enough to your patient with a wide base of support for stability. Direct the patient to move forward on the surface in preparation to stand and transfer. Some clients will need a verbal and physical cue to initiate the stand. Cue your patient to push off the bed with their own arms and to assist with the stand. Once the patient stands up, verbally direct them to sit or move towards the desired location. Some clients will need a gentle physical cue to help direct them in the right direction. Be sure your patient is sitting in an appropriate position. A patient should be seated with full back support and in a neutral pelvic position. The last step to completing a patient transfer is to ensure that your client is left in a safe and comfortable environment. Before leaving your patient, assist the client in replacing the setting on their footrest, the orientation of their armrest, or reattach items such as IV lines or leg bags. Ensure you are leaving your client in a safe position with access to call bells or other necessities. Also, ensure that your client is comfortable. Check clothing, lines, temperature, and recreational comfort. Proper positioning is essential to client function and prevention of deformity. Check that your patient's pelvis is level, and make sure that the patient's knees are also level. So now that we've learned how to conduct the 3 stages of a supervised transfer, let's see this transfer being done with all 3 stages combined. After administering a transfer, it's always good practice to perform a self-assessment check. Take note on how the transfer went, how the patient felt, as well as how you felt. Reflect on your surroundings and recount your steps. How was your posture and positioning during the transfer? Did you forget any steps? Was there anything you would do differently next time? Always take your experience and use that knowledge to improve and empower you to build on your skills and technique. Next up, you'll learn how to conduct a standing pivot transfer. Thanks for watching. Until next time, take care.